Let's finish the discussion on Chapter 57 by discussing diverticular disease. Diverticula are pouch-like herniations of the mucosa off the gut. They're most common in the sigmoid colon. Diverticulosis is the presence of many of these pouch-like herniations, while diverticulitis is the inflammation of those pouches. Usually this occurs when food or bacteria or those fecaliths, those stool stones, get caught in the diverticulum. Perforation can occur, and that's going to potentially cause abscess or peritonitis. They seem to occur most at points of weakness in the intestinal wall, kind of like how hernias show up in weakness in our abdominal muscles. This is going to be weakness in the intestinal wall. Risk factors for diverticula are just aging, but also lack of fiber in the diet and constipation can cause diverticula and therefore diverticulitis. Oftentimes people who have diverticulosis have no symptoms, and it might be found incidentally on some sort of abdominal scan, generally when they're looking for something else. A patient who has uncomplicated diverticulitis might have left lower quadrant pain and constipation, nausea, vomiting, fever, tachycardia, abdominal distension. Oftentimes patients with diverticulitis can be treated at home and don't need to be admitted to an inpatient unit. But complications can occur like sepsis, hypotension, hypovolemic shock, and that could be due to perforation and bleeding. If someone has diverticulitis, we might see elevated white blood cells, decreased hemoglobin and hematocrit, so anemia, and that would be because of bleeding. We might see electrolytes being off, especially if a patient has diarrhea, nausea, or vomiting, so that's of course going to affect our potassium. Their stool could be positive for occult blood. Abdominal x-rays could show free air and fluid, especially if there's been a perforation, and a CT could show an abscess or thickening of the bowel. An abdominal ultrasound could also show abscess or thickening. For these patients, we're going to be focused on pain control, rest, including bowel rest, broad spectrum antibiotics. We're going to make sure that we're avoiding laxatives with people with diverticulitis, and then teaching them about eating high fiber diets with whole grains, fresh fruits and vegetables, increasing their fluid, decreasing alcohol, and foods that could block the diverticulum like nuts, corn, popcorn, seeded cucumbers, tomatoes, figs, strawberries, and then decreasing dietary fat. But like I explained, there is a little bit of discussion about whether someone with uncomplicated diverticula or just diverticulosis really needs to have that much of a modified diet. Here is a figure of those diverticula. Those are those outpouching, and this is showing them off of the colon. Celiac disease is our last topic in Chapter 57. Celiac disease is chronic inflammation of the small intestinal mucosa, and that can cause bowel wall atrophy and malabsorption. So these folks are going to be potentially have other autoimmune disorders, so that's going to put them at higher risk. Symptoms of celiac disease are anorexia, diarrhea, constipation, steatorrhea, which are those fatty stools, abdominal pain, abdominal bloating, distension, and weight loss. It's thought to be a combination of genetic, immunologic, and environmental factors that cause celiac disease. Our primary complications with celiac disease, other than other autoimmune disorders are possible. Our biggest complication is going to be cancer, primarily non-Hodgkin's lymphoma or other GI cancers are seen with celiac disease. Management for celiac disease is dietary management. So it's going to be a gluten-free diet, and that usually helps the mucosa. And after like 2 years of a gluten-free diet, the mucosa can generally be seen as healed. That doesn't mean that they can start eating gluten again, but at least the mucosa can generally start absorbing vitamins and minerals better. We still are going to have to be educating these patients about supplementation.